Having surgery can be scary and intimidating. You may not be sure about what you should and shouldn't do. In this video, I will go through 5 things you can do to help your recovery. Hi, my name is Dr. Tasha and I'm a breast surgeon. Now I have to mention that this is simply a guide and is not a substitute to asking your own doctors for their advice. Let's get started. Number 5, take regular pain relief. It is likely that you would have been given pain relief tablets to go home with. Now generally, breast surgery, whether that's a lumpectomy or simple mastectomy, is well tolerated and isn't that painful. But it is really important to stay on top of the pain and discomfort. And the reason why doctors advise patients to take pain relief regularly for a period of time is so that patients can stay on top of the pain. Otherwise, you will be forever chasing it, and that's not a good thing to do. Also, if you're in pain, you won't be able to move as freely or even breathe as deeply, which can lead to stiffness and even chest infections. So at least for the next few days post-surgery, good pain control is really important. And after a few days, once there is no pain, then you can stop taking the painkillers. Number 4, arm and shoulder exercises. Another reason why it's important to be pain-free is so that you can do these exercises. Your doctor or breast care nurse would have advised you as to what kind of exercises you need to do. The reason why these exercises are important is because following surgery, you can develop stiffness, especially around the arm and shoulder. And moving them will minimize this from happening and making sure that they will continue to move freely. This is especially true if you need radiotherapy, because being able to lift your arm straight up is vital. So make sure you do these exercises. It's important to say though that if you've had breast reconstruction, make sure you ask your doctor when you can start doing these exercises. Number 3, wear a supportive bra. This can be really beneficial, especially after a lumpectomy or mastectomy with reconstruction. Wearing a bra day and night will really help. It keeps the breast in place and minimizes movement, and this can make recovery more comfortable. If you can find a bra that has the fastening at the front, that would be really helpful, but any kind of bra that is comfortable and provides support will help. If you don't have a supportive bra, a sports bra or even a tight hugging vest will do the job. Wearing a supportive bra can also help with the healing process, which is very important too. Number 2, movement. Now in the past, people would stay for days in hospital following surgery. I remember when I was training, we would do ward rounds of patients who've had breast surgeries. And actually this is still true if you've had a breast reconstruction. Otherwise, most surgeries now are done as a day case, and we know that patients recover far better at home. Whilst it is of course necessary to take rest when you feel tired, it's also important that you continue to move. The last thing you want to be doing is be lying in bed or sitting in a chair all day. Not only will this make your recovery quicker, but it can also minimize the risk of getting things such as blood clots and chest infections. Now there is a caveat to this. Again, if you've had breast reconstruction, then please ask your doctor's advice about how much movement you can do and when to do it post-surgery. And number 1, be kind to yourself. Going through surgery is tough, and it's important to listen to your body. If you feel that you're not being up to being sociable or not in the right frame of mind to speak to anybody, then that's okay. If you feel that everything is getting on top of you and all you want to do is to have a good cry, then that's okay too. If you feel you're tired, then take a rest. A breast cancer diagnosis is life-changing, and being kind to yourself is really important to help you get through your treatment and your recovery. I hope this has been helpful. Do subscribe if you want to learn more about breast cancer and health, and I'll see you in the next video.